Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us once again, Rob Leake. He is the Executive Director of Hospital Services and the Director of Financial Operations. Welcome, Rob. Thanks for joining us once again.
Thanks for having us, Sandy. I'm glad to give a brief update on where we are with the Behavioral Health Hospital expansion. We are optimistic and hoping, if all goes well, according to state survey, coming on December 8th, that we will be open and admitting our first patients middle of December. That is our goal right now. The construction folks are hard at work finishing up the last punch list items and getting us ready for fire marshal, building inspector, all those good things. Our beds are all in, our furniture's all in. We're just ready to get the unit up and running. The staff has been hired, so we're ready to go. We just need the final approvals and hoping that there's no other hiccups along the way, but looking forward to having our first patients admitted middle of December.
That's wonderful news, Rob. Thank you so much for getting us up to date. We can't wait for that wonderful, wonderful unit to open very soon.
Thank you.
And turning now to the latest medical news, Dr. Schwartz, coronavirus cases are rising nationwide, and unfortunately that's a trend we didn't want to see heading into the holiday season. But according to one study, there is something we can all do to help prevent the spread and keep each other safe and healthy. Can you tell us more?
Well, I can, Sandy. You know, it's funny, we've been doing these shows more than a year, and I think this is one show I have more to say than I probably did in all these other shows in the past. So it shows you how much continues to happen with COVID. So what I'm going to try to do today is really present two articles. And again, I try my best, they're long articles. I try my best to condense them and give you the key points, but they are two different topics, but they are important. And I'll start with the first article. And this article, and again, what I'll do is sort of read parts of the article and give some quotes as well, so you see what experts are thinking and so forth. The first article is entitled, "Mask Wearing Cuts New COVID-19 Cases by 53%. It's the best public health measure against the virus," a study finds. So the essence of this is that the mask wearing cuts the number of new COVID-19 infections by 53%, and this is according to a new peer-reviewed study in the British Medical Journal, which found the controversial and highly politicized precaution to be the single most effective tool against the coronavirus. So now they give some key facts, so like 3 key facts, and I'll read them to you. The first one is mask wearing, social distancing, and hand washing are all effective at lowering the number of new COVID-19 cases, according to an analysis of evidence from 72 global studies that looked at non-pharmaceutical public health measures. The second point they made is mask wearing was the most effective public health measure at reducing the incidence of COVID-19, which is what the study found, while physical distancing reduced incidence by 25%. And finally, they talked about hand washing, and they said hand washing was found to reduce coronavirus incidence by 53%, though the researchers noted this finding was not statistically significant on account of the small number of studies that assessed hand washing. Now I'm going to go over what they found as the key background in this study. And they said, though masks have been a critical tool in curbing the spread of COVID-19 from early on in the pandemic, they have become a flashpoint in a culture war pitting individual liberties against the public good. In the United States, mask mandates had spurred protests, conspiracies, and been a hot button issue for politicians to jump on, even as cases and deaths soared. Tensions have been so high that mask-related disputes have led to a number of violent altercations, some lethal, while some states have prevented local officials from putting their own rules requiring them in place. So we're almost done with this first article, by the way. I'm trying to move along, but so they say first, what we don't know. So getting the pandemic under control is likely to depend on both high vaccination coverage and ongoing adherence to effective and sustainable public health measures. More research will be needed to assess the effectiveness of public health measures as highly vaccinated populations. And this is a quote from the from the researchers of this paper, and they said the lack of good research on public health measures to tackle COVID-19 is one of, as they say, the tragedies of the pandemic. And they say more and better research are needed. And finally, they say the big number, 4%, that's how much of global research funding for COVID-19 goes into assessing public health measures, according to the editorial's authors. Considering the central importance of public health measures for pandemic control, the uncertainties and controversies around them, this lack of investment in public health measures is puzzling. That's a quote from the authors of this paper. So the final point here, they said, and this, they call this a surprising fact, they say only one randomized trial of a public health measure was identified in this review. In contrast, hundreds of such trials have been completed for pharmaceutical treatments for COVID-19. So I think that's important because it shows you still the importance of what we had said all along over this year, still the importance of good preventative health practices, wearing masks, hand washing, social distancing still being very important as the pandemic still is present. So the second article, and it's even more brief, and I'll try to make it even more brief, but I think it's important, and we all thought it was important, talks about this: the CDC expands eligibility for COVID-19 booster shot to all adults. So the CDC director, Rochelle Walensky, quickly signed off on the changes, which will vastly simplify delivery of COVID boosters. So these are some quotes from Rochelle Walensky, and she said, booster shots have demonstrated the ability to safely increase people's protection against infection and severe outcomes, and are an important public health tool to strengthen our defenses against the virus as we enter the winter holidays. Based on the compelling evidence, all adults over 18 should now have equitable access to a COVID-19 booster dose. So these new recommendations state that people between ages of 18 and 49 who have no risk factors may get a booster if they wish. All other people should get a booster. From now on, health personnel administering booster doses will need to ask two simple questions of people who receive one of the mRNA vaccines as their primary COVID series. So these are the two questions. The first one, are you 18 or older? And the second one, has it been 6 months or longer since you received your second shot? So these changes pertain to the messenger RNA vaccines made by Pfizer and Moderna. People who receive these vaccines can get a booster shot 6 months or more after receiving their second dose of vaccine. People who received the one dose Johnson & Johnson vaccine have already been cleared to receive a booster shot 2 months after the original shot. So I think from both of these articles, the conclusions are this. And they say we've come a long way, but this is a time of year where germs are more prevalent and COVID is not over. Unfortunately, rates are rising, Connecticut being among the highest. So what's the take-home message for all of this? Plan safe holiday get-togethers. Masking is a good idea even when vaccinated, particularly indoors, and it's proven effective at preventing transmission. So hopefully many of you are still out there listening despite this long presentation. So to hear my inspirational quote, which says, we can't direct the wind, but we can adjust the sails. And that was said by Thomas S. Monson. And he's an American religious leader and the 16th president of the Church of Jesus Christ of Latter-day Saints. So I guess during this day before Thanksgiving, I guess I'm thankful for working with all of you and how hard everybody pulls together to just continue to keep our residents safe and be diligent toward everything together. And again, as I always say, happy Thanksgiving to everybody, and I wish everybody health, and I wish everybody peace. And thank you.
Thank you so much, Dr. Schwartz. We're thankful that you always bring all the information to us in such a succinct way and keep us updated. And GP, speaking of Thanksgiving, as we prepare to gather and celebrate tomorrow, and with Hanukkah just days away, I know you really wanted to take a moment to express your gratitude and give holiday wishes to our entire Masonicare family.
Sandy, thank you. First, I'd like to thank Rob Leake and his team for getting the behavioral hospital construction to where it is today. It's been a not so pleasant time going through so many things such as shortages of material, labor, but we are very close. And I just want to thank Rob and his team for getting us to this point. I know he's been frustrated in so many ways, but let's give thanks for being able to get to this point and working as hard as you have. So Rob, thank you to you and your staff for all that you've done during this time. You are welcome. When we think about COVID, and Dr. Schwartz was saying a little bit, we're seeing an uptick here in Connecticut, and he is absolutely correct. However, what I do want to say is we're about 60% less in the number of cases from last year, same time frame for the whole month of November. So we are seeing an uptick, but it's still substantially less than what it was this time last year. And I think that's important because that's telling us the vaccines and the boosters are working, and along with people are still being vigilant. And obviously with Thanksgiving just around the corner and Hanukkah around the corner, we need to make sure that we are staying vigilant. There's a quote by Danielle Duckery that it's hit me a little more this year than I think it has in the past. And that is, Thanksgiving is a time to give, a time to love, and a time to reflect on the things that matter the most in life. And when we think about that, our staff have been giving of their hearts for such a long time. And this past year has been a continued stressor. This time last year, we were at the height of the COVID outbreak or cases in Connecticut. So it was an extremely stressful time, and we've been able to battle through it. And our staff have just done a truly amazing job at giving their time, giving their love to the residents and staff and each other. And I think when I look back, I can't tell you how proud I am of our staff being able to really work through the adversity that we have, and they continue to give. They continue to give their hearts to those that were entrusted to serve. So on this Thanksgiving, I will be reflecting on what our staff have done. I can't tell you again how proud I am of them, of our staff, and even our residents who have started to come out and have really some exciting events. Recently Astor Village did a variety show, and leadership was able to be part of that variety show. And I can't tell you how the residents really were extremely happy with all of us being there. So it's bringing the family back together. And this Thanksgiving, we should see more families getting together. And our family is also melding together so much more, making us Masonicare strong. Last part to all that, though, is you still need to be vigilant. We need to continue to fight the battle so that we don't see major upticks. But I know that our staff and our families are truly making sure that they are being vigilant in that. So happy Thanksgiving, happy Hanukkah to all of our staff, all of our friends in Masonicare, and all of those that we serve.
Thank you so much, JP. Perfectly said. Well, I want to thank all of you for sharing your time and your insights with us today, as always. And of course, we thank you for joining us at home. Until we see you next time, we wish you joyous holiday time with family and friends. Stay safe and stay well.
Happy Thanksgiving, everyone.